everyone, this is Sangeeta Gopi from Medcity International Academy. What is it that makes you an effective speaker or communicator? Is it how fast you speak? Is it speaking without gaps? Or what is it really that makes you a good speaker? Well, if you're under the impression that speaking non-stop without any gaps is what makes you a very good speaker, then I would say that's a misconception. Yes, you heard it right. Speaking fast without any gaps does not make you a fluent speaker. So what is it exactly that makes you a very effective speaker? Well, I would say it's the pauses. You heard it right. The right pauses at the right places will make you a real effective speaker. So let's take this concept into the context of OET speaking. How can you use pauses to make your speaking or your roll card more effective? But is there a real guideline or a rule book that you can follow? Is there something that I can give you as a mantra that you can take and make sure that you can, if you apply that, you will make sure that you have the right pauses everywhere? Definitely not. But from experience and after having interacted with a lot of people across profession, after having referred a lot of books and websites, I can give you certain tips that you can utilize in your OET speaking, pauses that can be utilized to ensure that your OET roll card becomes really effective. Where can pauses be used? The first one would be to encourage the patient's understanding. Let's say you're giving some information to the patient and you do it, let's say, in a very a sequential order. So you've given the first suggestion, the second suggestion, you've given certain other important aspects. So when a lot of information is given to the patient, it becomes really difficult for the patient to imbibe all of it. So you need to make sure that you pause after having delivered certain piece of information. And when you pause, you're ensuring that that particular point that you've just delivered sticks to the patient's mind, or it helps him digest what he just heard. For example, there is a roll card where there's a home visit. A nurse visits a patient in his home to show him how insulin injections can be used. So there's a lot of information that the nurse has to give, like checking with the patient why he has to give insulin injection, what he already knows about diabetes and his take on moving from tablets to injections. So there's a lot of information that the nurse gives, and there's this particular area where the nurse describes to him or explains to him the different sites in the body where the insulin injection can be administered. So this is how you can utilize a pause. So I'm speaking to Alex and I say, so Alex, there are certain areas of your body where you can safely inject your insulin. It's not all the parts, because you need to make sure that this area where you actually administer the injection is quite thick. There's a lot of fat in that area. For example, the abdomen, your arms, the buttocks, maybe the hip area, or the front or the side of thighs. And then you pause for a few seconds. And when you pause, the patient is basically trying to imbibe the information that you just delivered. Another area where you can give a pause is immediately before or after you give an important point, okay, for impact. For example, I have the patient's blood reports with me. and I'm communicating what I just learned from the blood reports. So I tell the patient, so John, I do have your blood reports with me, and from the reports it's quite clear. And then you pause because you're trying to give or convey an important point, and then you say, it's negative, there's nothing to worry, you're completely safe. So this will create an impact when the patient listens to the to the news or the information that you've just delivered. So this is an area where you can pause. I would say a third aspect or a third area where you can try administering a pause is to encourage the patient's participation. That is, you've given some information to the patient and you're giving them some time or an opportunity to clarify what he or she just learned. For example, there is a roll card in which a son visits the reception of the hospital. His father has to undergo dialysis and he is really not sure about dialysis and what it is all about. So he goes to this reception desk to get more information about dialysis. So in this context, when the nurse at the reception gives him information maybe about why in the first place his father has to undergo dialysis, what is the status of his kidney, and how often probably the dialysis needs to be done, the nurse can pause for a few seconds. And when the nurse pauses, the person that she's speaking to imbibes all this information, he takes it in, and then maybe he has certain doubts, maybe he needs to have certain clarifications. So he has an opportunity to clear his the questions that he has in his mind. For example, he may want to know how often his father has to be brought to the hospital. Or he may also want to know what are the different things that he needs to keep in mind, or some precautions that's to be taken before his father is brought for dialysis. So it gives the person an opportunity to ask certain questions to the nurse. So it's an opportunity or it's a way of encouraging the patient to participate in the conversation. So that's another aspect where you can effectively use your pauses. And the last one for this particular video series, I would definitely say, is to give the patient some time to think about or feel what he or she just learned. Something like giving them a space to let out their emotions. For example, the previous example that I spoke about, I have the patient's blood reports with me and I just convey to the patient that the patient is completely safe and fine and there's nothing wrong with him. So I pause for a few seconds after that, probably for the patient to shed tears of joy, maybe to let out a sigh of relief. So you need to pause so that you're giving them an opportunity, a space or an area to express the emotion. So that's another area where you can use your pauses effectively. So I hope you've now understood that speaking fast and non-stop does not really make you a fluent speaker, or an effective one at that. So if you're able to use the pauses at the correct spaces and effectively, you can make sure that you convey your information in a more effective manner. So hope this video helped you. Thanks for watching.